The U.S. healthcare system is not as effective when it comes to controlling costs compared to systems in other countries.
Health insurance costs are climbing at the highest rate in years, and they're not expected to ease anytime soon.
The Affordable Care Act includes a rule that insurance companies must spend at least 80% of the money made from premiums on healthcare costs and improvements.
But I think the biggest single driver is our fee-for-service system that rewards volume instead of value and quantity of medical services instead of quality.
Employer coverage costs will go up about 6.5% next year.
They have health insurance, but they still can't afford to get the health care that they need.
My husband and I had conversations about divorcing so that we could get Medicaid for our son.
Rosie Alvarado came to the U.S. 20 years ago, and not having health insurance was not an issue until 2 years ago when her husband got seriously ill.
By the end of 2022, my husband presented some symptoms that his primary doctor said that it might be cancer. So we didn't have insurance at the time, and we don't have insurance. So we have insurance in Peru, so we go to Peru and we get many appointments very fast, and he got diagnosed. In a moment like that, you feel like everything fell apart, and the perspective of things change. Something that was important yesterday is not anymore, just like the health of the loved one.
Medical expenses in the U.S. have tripled since the year 2000, and millions continue without health insurance. For some patients in the U.S., traveling to other countries for their healthcare has become an alternative. This is called medical tourism. Daniel Smith, an employee at a prominent bank in Brickell, faced financial strain due to high medical costs. It was his Mexican wife who opened his eyes to the affordable medical care available in her country, a discovery that brought him much-needed financial relief.
I remember I was probably 27, 28, just started working, and I had to get a root canal. And I was working an internship at the time. I wasn't making a lot of money, and a root canal cost me $3,000. So I was $3,000 in debt for something that in Mexico would have cost me a fraction of the price. At the time, I hadn't met my wife, we weren't married, so I didn't know of this other opportunity. And it's not that relevant, but I guess at the time it was pretty significant.
The medical tourism industry has increased globally in recent years. Americans are traveling to countries such as Canada, Cuba, Costa Rica, Colombia, Brazil, and Argentina for medical attention. Many patients are looking for less expensive medical options in the US. However, sometimes it is not enough. Social worker Carla Moreno has been working in the mental health field for 2 years, the first year as a case manager and the second year as a therapist. She explained why this is an issue.
So a lot of people will go to community mental health or health centers, get a social worker, and the social worker will try to, get services covered for them. But then a lot of the times they do have a copay. They have to provide that copay, and a lot of the times they don't have that money. A lot of jobs don't offer health insurance. A lot of the health insurances that the jobs do offer are not good because even if you have health insurance, there's still a very high copay. So, okay, I have insurance, but I can't afford the copay. So what am I gonna do? I'm not gonna go to the doctor. I'm not gonna get treated.
Travelers look a variety of medical treatments worldwide. Cosmetic surgery, dental, fertility, orthopedic, cardiology, and cancer lead the list of the most requested procedures. Dalisbel Alvarez was born and raised in Cuba. She came to the US at the age of 14. She now has 2 countries where she can get medical attention, although she prefers Cuba.
I had a medical emergency once, that a treatment that I needed to receive in my leg because I got injured. And when I went to the hospital here, it was a very expensive treatment. But I had the time to go to book my flight and I go to Cuba and get the treatment that I needed in Cuba. I have always had good experiences going back to Cuba and getting medical treatment, because here in the United States I don't really have a good experiences whenever I needed to get anything done. The hospitals usually take a lot of time, even if it's an emergency, or if you have to book something, it takes a lot of time. So I have health insurance just in case of an emergency here, but if I have the time, I definitely go back to Cuba.
Medical experts and researchers warn about the danger of traveling abroad for medical procedures. Mexico is one example where many have faced complications, including death.
Experts say U.S. citizens are still flooding the southern border for low-cost cosmetic surgery. Data shows more than 1 million Americans go to Mexico every year for medical tourism.
There are definitely medical risks. So, of course, with the group in Mexico, we saw that they traveled to an area high in crime. So that's a risk when it comes to travel itself.
Doctors from other countries have noticed an increase in foreigners arriving to their clinics. Dr. Luisa Maniego, a physician from Tarapoto, Peru, understands why this is happening.
Acá en el Perú atendemos pacientes del extranjero principalmente con lo que sea cirugía estética y cirugía bariátrica, que está muy de moda, sobre los costos, y lo hacen en centros adecuados y acreditados para no tener ningún inconveniente y tener una evolución muy buena.
One of the most requested treatments by visitors is dental. Dr. Caterina Hurtado, an odontologist also from Tarapoto, Peru, sees many patients from other countries.
Aquí en el consultorio estamos en una ciudad que se llama Tarapoto, en Perú, y recibimos un aproximado entre 15 a 20 pacientes al mes que son extranjeros y nos comentan que deciden venir o viajar a hacer un turismo quizás nacional, conocer nuestro Perú, pero con la garantía de también realizarse tratamientos odontológicos.
Medical tourism is convenient, but not without dangers. For this reason, companies like the International Clinic aims at making your trip safer. Dr. Babumba, owner of the clinic, advises patients considering a medical trip to another country.
When people research where to go overseas to get services, they should look into getting adequate protection from here before they leave. And some of these things like the vaccines, etc., those are part of routine care here, and most insurances pay for them. So they should really consider getting advice here from their physician before going overseas.
As long as healthcare costs continue to increase in the US, medical tourism will continue to grow globally, leaving many with few options.
I will keep my insurance in Peru, and I won't get insurance here for now until I need it. I don't need it right now. For my husband, he's gonna keep both because he has an illness and he has to continue with his checkups and everything. So for him, it works for him to have insurance here, but not for me right now.
So I do a lot of these doctor's visits, dental visits in Mexico because my wife's family is there. So all we have to do is buy a plane ticket. We stay with her family, we stay with her relatives. She gets to visit her family. And I don't know, it's easier. And especially now that we live in South Florida, the plane is a 2-hour trip and we're in Mexico.
I would definitely keep going back to Cuba to get myself anything medical related over there. I don't like the health insurance here in the United States, so it's very expensive. So I would definitely keep going back whenever I can if I need to get something done.